Today, I am presenting a quality improvement project titled Targeted ICU Documentation Improvement Initiative, Cycle 1. I am Dr. Hubble, and I worked in collaboration with Dr. Smith, Dr. Razak, Ms. Barrett, Dr. Sadin, and Dr. Esber. Our quality improvement project focused on improving poor documentation and poor understanding of the life-sustaining therapies used in critically ill patients. We specifically focused on the patients who were admitted to the ICU. Our literature research has found that resident education about ICU documentation is variable and unstructured. This is an opportunity for improvement, and is especially appealing because educational interventions are a time-efficient way to impact many residents. Our objectives were firstly to improve the understanding of specific ICU diagnoses by internal medicine residents, and secondly, to improve the ICU documentation of life-sustaining therapies by the residents. We started first with the PDS cycle, which is seen in the center of our poster. This included a root cause analysis to identify barriers of accurate ICU documentation. Some of the barriers we identified included staffing, equipment, methods, and the acuity and volume of patients. Specifically, in regards to methods, we identified that inconsistent education contributes to variable documentation. Moving along to the Do section of the PDSA, we elected to create a guidance tool that was shared with all of the ICU residents by email and as a printout. We also organized an IM resident didactic lecture, and these resident-led teaching sessions were delivered weekly in the respective ICUs. We started our quality improvement initiative on January 15th, 2023 at the Detroit Receiving Hospital and Harper University Hospital ICUs. We targeted the following main ICU diagnoses and associated life-sustaining therapies for our first cycle: respiratory failure, shock, renal failure, analgesia and sedation, nutrition, and catheters and devices safety. We assigned data points to each of these targets to provide accurate and high-quality documentation. These data points were then audited in the ICU resident notes before and after our implementation. The final stage, the ACT portion, involves identification of additional barriers to quality documentation. We can use this to incorporate more or different data points, and we can modify the education materials to be more targeted, especially in regards to categories with low documentation rates. As you will see in our results section, the accuracy of each data point is variable, and some data points were more affected by our educational series than others. Looking at our results, you will see that we had 41 ICU documentation encounters in our pre-intervention phase and 24 in the post-intervention phase. And overall, the results were good. The accuracy of ICU documentation increased after our intervention. For respiratory failure documentation, ventilator settings improved from 35 to 69%, and weaning parameter documentation improved from 31 to 36%. Shock showed improvement as well, with pressor name and rate increasing from 70 to 100%, and end organ hypoperfusion improving from 50 to 57%. Analgesia and sedation saw a significant improvement, 8 to 50%. Continuous renal replacement therapy had 0% documentation for indications and goal of therapy before our intervention, but after the intervention, 25% of people documented indication and 75% of people the goal of therapy. Nutrition saw an improvement from 20 to 25%. In conclusion, the limitations in medical ICU documentation are numerous and variable. Education of the residents, guidance tools, and regular feedback are all important to improving targeted ICU documentation. Cycle 1 of our initiative has demonstrated that these tools are capable of making significant change in documentation accuracy. In the future, we hope our next interventions will target additional limitations. Cycle 1 of our documentation initiative has already demonstrated hope that we can increase and sustain high-quality medical ICU documentation. Thank you for your time.